Hello everyone, today we'll be talking about the ABCD² score. So this is basically a score that is used to predict the risk of a stroke after a transient ischemic attack. So the ABCD² score is a risk assessment tool that is designed to improve the prediction of short-term stroke risk after a transient ischemic attack. So the score is optimized to predict the risk of stroke within 2 days after a TIA, but it also predicts a stroke risk within 90 days. The ABCD² score is calculated by summing up points for 5 independent factors, okay? Then if you get a higher ABCD² score, these are associated with a greater risk of stroke during the 2, 7, 30, and 90 days period after a transient ischemic attack. So when you talk about the ABCD² score, so if you look at the letters A, B, C, D squared, so D squared is basically 2 Ds, okay? So A stands for age. So if age is above 60, that gives a score of 1. Then B is BP, blood pressure. So if systolic BP is above 140 or diastolic blood pressure above 90, so that also gives us a score of 1. Then under clinical features, so C is for clinical features, okay, we choose any one. So if they present with any unilateral weakness, such as in the face, arm, or leg, with or without speech disturbance, that gives us a score of 2. Then if they have speech disturbance without any motor weakness, that gives us a score of 1, okay? Then duration of symptoms, so that's our D. So if it's less than an hour, which is basically 10 minutes to 59 minutes, that gives us a score of 1. If it's longer than 60 minutes, that gives us a score of 2. Then the other D is diabetes. So if a patient has diabetes, that gives them a score of 1, okay? So now we count our total. So if the score is 0 to 4, the 2-day stroke risk is 1 to 4%. So for such patients, hospital observation may be unnecessary without another indication, such as if they have atrial fibrillation, maybe we might admit them for observation. However, if it's 0 to 4, they don't need hospital observation. Then if the score is 5, the 2-day stroke risk is at 4%. So hospital admission is usually justified in most of the situations. Then if they have a score of 6 to 7, the 2-day stroke risk is 8.1% and hospital admission is recommended. So evaluation of patients with a TIA, so you need to do a prompt initial evaluation within 12 hours and the evaluation is usually completed within 48 hours. Then hospitalization, this should be considered to facilitate early therapy and secondary prevention. Then follow-up test, you can do a full blood count, urea and electrolytes, fasting blood glucose and lipids. Basically, we're trying to look for the source. Then you need to perform an ECG in all patients. Then you need to do a brain imaging MRI within 48 hours. Then vascular imaging, you can do carotid imaging, CT or MR angiography or transcranial Doppler within 48 hours. So basically this is the same thing that I was explaining earlier. So that's all about the ABCD² score. Thank you for watching.